Masturbation is a natural and common behavior among men, yet myths and cultural taboos often cloud discussions about its health implications. One area of growing scientific interest is the relationship between ejaculation frequency and prostate health. The prostate is a walnut-sized gland beneath the bladder that produces seminal fluid. Prostate cancer is one of the most common cancers among men, and benign prostatic hyperplasia, BPH, can cause uncomfortable urinary symptoms. Understanding how ejaculation might influence these conditions can inform healthy lifestyle choices. This article reviews the evidence linking ejaculation to prostate health, debunks common myths, highlights potential downsides of compulsive masturbation, and outlines a broader strategy for supporting prostate well-being. The prostate and why it matters. The prostate encircles the urethra just below the bladder. It secretes fluid that nourishes and transports sperm. With age, the prostate is susceptible to inflammation, enlargement, BPH, and cancer. Maintaining prostate health is important not only for fertility but also for urinary function and overall quality of life. Ejaculation frequency and prostate cancer. A landmark study from Harvard University followed over 31,000 men for 18 years. It found that men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times monthly. Researchers propose that regular ejaculation may help flush out potentially harmful substances or inflammatory agents from the prostate ducts, a theory called the prostate cleanse hypothesis. Other benefits may include reductions in stress and improvements in hormonal balance, as orgasm releases endorphins and oxytocin, which lower cortisol levels. Subsequent studies, including a 2017 paper in the Journal of Sexual Medicine, have echoed these findings, suggesting that frequent ejaculation in one's 20s and 30s may provide long-term protective effects. While more research is needed, the evidence indicates that orgasm, whether from masturbation or partnered sex, may reduce the risk of prostate cancer. Debunking common myths. One myth: masturbation causes infertility. Masturbation does not harm sperm production or quality. The testes continually produce sperm, and ejaculation simply releases existing sperm. Infertility is typically related to hormonal disorders, genetic factors, infections, or anatomical issues. 2. Myth: masturbation weakens the body or drains energy. No scientific evidence supports the claim that ejaculation depletes vitality. On the contrary, orgasm releases hormones that promote relaxation and stress relief, which can enhance overall energy. 3. Myth: masturbation prevents all prostate problems. Although frequent ejaculation is associated with a reduced risk of prostate cancer, it does not prevent BPH or prostatitis. BPH is linked to hormonal changes and aging, while prostatitis is often caused by infection. Masturbation is not a cure-all when masturbation becomes problematic. Like any behavior, masturbation can be unhealthy if it becomes compulsive or interferes with daily life. Signs that the habit may be problematic include neglecting work, relationships, or responsibilities in favor of masturbation. Physical discomfort, such as chafing or decreased sensitivity, especially if using excessive force, or death grip. Difficulty achieving orgasm with a partner due to reliance on intense stimulation. Emotional distress or feelings of guilt and shame. In such cases, reducing frequency, experimenting with gentler touch, and exploring intimacy with a partner can help reset arousal pathways. If pornography use drives compulsive masturbation, limiting porn consumption or seeking therapy can address underlying issues. A balanced approach to prostate health. While ejaculation frequency may contribute to prostate health, it should be part of a broader strategy. Consider these evidence-based recommendations. 1. Prostate diet. Emphasize fruits, vegetables, whole grains, and healthy fats. Tomatoes, rich in lycopene, cruciferous vegetables, nuts, and fatty fish like salmon may support prostate health. Limit red meat, processed foods, and excess dairy, which can promote inflammation. 2. Regular exercise. Aim for at least 150 minutes of moderate aerobic activity per week combined with strength training. Physical activity improves blood flow, helps maintain a healthy weight, and reduces inflammation. Pelvic floor exercises, Kegels, may also support urinary control and sexual function. 3. Routine screening. Discuss prostate-specific antigen, PSA testing, and digital rectal exams with a healthcare provider starting at age 50 or earlier if you have risk factors such as family history or African ancestry. Early detection of prostate abnormalities increases treatment success. 4. Stress management. Chronic stress exacerbates inflammation and hormonal imbalance. Practice relaxation techniques, engage in hobbies, and ensure adequate sleep. Mindfulness meditation, yoga, and deep breathing can help reduce cortisol levels. 5. Open communication. Discuss masturbation and sexual health openly with your partner. Mutual understanding can prevent conflicts and foster intimacy. Conclusion. Masturbation is a normal aspect of male sexuality, and regular ejaculation may lower the risk of prostate cancer by flushing out harmful substances and reducing stress. However, it is not a panacea for all prostate conditions, nor is it inherently harmful. Like most health behaviors, moderation and context matter. When masturbation is balanced with other healthy habits, such as a nutritious diet, regular exercise, routine medical screening, stress management, and open communication, it can be part of a comprehensive approach to maintaining prostate health. If concerns arise about frequency, physical discomfort, or sexual performance, consulting a healthcare provider or therapist can provide personalized guidance. Understanding the science dispels stigma and empowers men to make informed decisions for their long-term well-being.